What is the crisis protocol for Tele-mental health psychiatric consultations? Imagine you're talking to someone about your feelings and suddenly things feel overwhelming or unsafe. How do mental health providers make sure you're okay when they can't be there in person? That's where the crisis protocol for Tele-mental health psychiatric consultations comes into play. It's a step-by-step plan that helps providers respond quickly and safely if a patient is in crisis during a remote session. Since these consultations happen over video or phone, providers need clear rules to handle emergencies effectively. First, at the start of each session, the provider asks the patient to confirm their exact location and emergency contacts. This is super important because if a crisis happens, emergency services need to know where to go fast. The provider also shares their own contact details and discusses what to do if an emergency occurs between sessions. Next, the provider keeps a close eye on the patient's mental state, looking for signs of immediate danger like suicidal thoughts or severe distress. If the patient shows signs of danger, the provider assesses how serious the situation is. There are clear steps for emergency responses. The provider decides when to involve emergency services and may instruct the patient to call 911 if needed. If the patient can't or won't call, the provider will contact emergency responders directly, giving them the patient's location and relevant details. Because the provider isn't physically present, they also need to know about local emergency resources and laws, including rules for involuntary hospitalization if someone is a danger to themselves or others. They often work with local healthcare staff or family members to make sure help arrives quickly. Many telehealth services recommend having support persons nearby during sessions, especially if the patient is at risk. This could be a trusted family member or friend who can assist if a crisis occurs. Sometimes, sessions happen in supervised settings with medical staff present, which adds an extra layer of safety. During a crisis, the provider stays in contact with the patient, offering reassurance and guidance. After the emergency, follow-up care and planning are essential to help the patient recover and prevent future crises. Providers also document every crisis event and response carefully. They are trained to handle emergencies remotely, understanding the unique challenges of telehealth. For young people using tele-mental health services, knowing this protocol helps them feel safer and more prepared. They should be ready to share their location accurately, have emergency contacts handy, and understand that their provider has a clear plan to help if things get tough during or between sessions. If a young person feels overwhelmed or in danger during a tele-mental health appointment, the provider will guide them through immediate safety steps. This might include calling emergency services or involving someone nearby who can help. All of this is done through secure, confidential platforms designed to protect privacy while enabling quick action. The goal of the crisis protocol in tele-mental health psychiatric consultations is to balance easy access to care with safety, making sure help is always available when needed, even from a distance.